Hi everyone, this is Dr. Dheeraj Mulchandani. I just want to spend a couple of minutes with you taking you through the journey from our first lockdown in March because of the current corona or COVID 19 pandemic right up to the point where we've reached today. Now, the virus was native only to China, and as people traveled across the globe, the virus has traveled with them, crossing borders. Unfortunately or fortunately for us, we received our first case late in February. By the time our measures were getting into place, we were forced to enforce a lockdown and a complete lockdown. And the primary purpose of that lockdown was to give the government time to prepare and to educate people on how to go forward. End of March, we had a complete sudden lockdown where nobody was allowed to travel out at all except essential medical services. The first week of the lockdown gave the hospitals and the medical teams a guideline on how to go forward and what we should do as the number of cases would start rising, which we were expecting. Come April, we were slightly in a better position, but we were still lagging behind with the number of cases testing positive and our number of beds not increasing fast enough. Therefore, the lockdown was extended to give us further time to create emergency beds, to create hospital spaces where patients could be admitted, because this virus, it was known, is deteriorating patients' health rapidly and not slowly and gradually over time. There were people who were fine one day and on the ICU ventilator the next. So we needed time to increase our bed capacity so we could be in a position to treat the patients who really required it. May, and we started seeing some easing with essential services being opened, shops being opened on one side of the road on alternate days, 50% staff being allowed in the offices, provided all the necessary precautions were followed. And we'll come to you about the precautions that needed to be followed. June, and the first unlock was announced where people were now allowed to go out of their houses at least in the daytime, with the night curfew continuing. Each state in India had their own protocols, and the central government added just guidelines, and each state were left to make their own protocols depending on the number of cases we had. I'm glad to say that there are many states in India that have very few cases and they are almost open completely right now. I'm in Maharashtra, and Maharashtra is still under lockdown until the end of this month, which is August, and we should gradually start opening as we are opening small offices. Small businesses have been allowed to open between 9 to 7 pm. Hopefully, we should get through this unlock together if you follow simple guidelines and precautions that you need so that you can avoid being infected by the virus.